Hi, and welcome to episode 266 of the Untethered Podcast. This is your host, Hallie, and you've just got me today. Today is going to be a quick episode because I want to talk about something that is, I don't know if I want to call it a pet peeve of mine, but it's something that we really need to discuss when it comes to functional evaluations and not skipping them in the feeding space, especially as part of a comprehensive overall evaluation, especially calling out all SLPs and OTs on this one. All right, so let's jump in. Quick disclaimer, all information, content, and material of this podcast are the opinions of the speakers and is for the informational purpose only and not intended to serve as a substitute for the consultation, diagnosis, and/or medical treatment of a qualified healthcare provider. Welcome to the Untethered Podcast. I am your host, Hallie Vulcan. I'm a certified myofunctional therapist, feeding specialist, podcaster, business owner, and mentor. This podcast is all about getting your questions answered and collaborating with colleagues to bring you the most up-to-date information in the orofacial myofunctional therapy, airway, tethered oral tissue, and pediatric feeding therapy space. If you're new here, I challenge you to keep an open mind and join my mission to spread this message far and wide. If you've been around since June 2019, thanks for being a loyal listener. As we jump into today's episode, remember to listen with correct oral rest posture. Tongue up, lips closed, teeth apart, breathe through your nose. Let's get started. Okay, friends. So as I said, there's something I want to talk about today. And of course, as you just heard, doors to Feed the Peds are open. So that is one of the reasons why I want to talk about this, because I do think that we should be having conversations around the type of assessment. Obviously we dive into treatment in the course, but I want to talk about something that I've seen come through in some assessments, right? I have a private practice. I have seen different reports come through that have been shared with me that say things like it's a comprehensive evaluation, but then you get to the oral motor section or the feeding section or whatever, sensory oral motor feeding section, right? And you're like, what's going on here? It says they did an informal assessment. They did not watch the child eat. They did not palpate externally. They didn't look internally. There's like no screening even happening here. Like I just taught everybody, if you guys are listening and you were joining live last week, we did that free 5-day screening that wrapped up. And, if you're like, I missed it. Well, if you join the Feed the Peds course, by the way, you do get lifetime access to that, to last week's training as a bonus. And we will actually, if you do join the course, we will actually submit for 5 official CEU hours for ASHA and AOTA for you all. So whereas you have to basically just count them on your own if you don't join the course, and that's fine too. But for those who want us to submit, it is a bonus that we do if you're actually inside the 12-week course. Where was I? What was I saying? Oh, right. It grinds my gears a little bit when I see these reports and it's like, this was a comprehensive evaluation. And you get to a section, it was like, no, this is not comprehensive because you didn't actually look at anything related to motor or sensory system or speech sometimes, right? It's like you go through and you're like, no. When you informally observe or you say you did not fully assess, okay, this is not comprehensive. This is not comprehensive. Maybe it's a comprehensive language evaluation. Can we call it that? Maybe it's a comprehensive speech evaluation. Can we call it that? Maybe it's a comprehensive speech and language evaluation. Let's call it that, right? But if you're not including everything that we do as SLPs, I don't know, just my opinion. Maybe we should be more specific about what we call the evaluation, because this one in particular just said a comprehensive evaluation. And I was like, comprehensive evaluation, what does that mean? Okay. So, and I know I'm being like super nitpicky here, but I didn't love that it said it was a comprehensive eval, because the parent then thinks they got all the things done. And then you get to some sections and you're like, where's the meat and potatoes? Oh, you didn't do that. You didn't even really do an informal screening, let alone, okay. And here's why I'm recording this episode. To then comment on it and say that it's not an issue when you didn't assess it and you don't actually know that it's not an issue. This is what I take it. This is what I take issue with. This is where I'm like, oh guys, come on, please. Like, just say this wasn't assessed, or this wasn't formally assessed, or this, wasn't assess to the degree that we can make a determination as to whether or not this is impacting function or function is impacted. Just make some kind of a statement that says, hey, I didn't actually assess this or look at this. So if you're curious about this, you might want further assessment, or you might want to see someone else who specializes in this, right? I mean, I just wanted to put that request out there. The other thing I think that we need to be considering is like function, right? Like, what is function? What is this family coming to us for, right? So we inherit kids from other practices all the time for a myriad of reasons. And it's always just very interesting to review their reports or their notes or whatever is coming our way, because half the time I think that we're forgetting to listen to the patient and why they're there in the first place. I do want to make a comment about apraxia in a moment. I'm going to write that down so I don't forget. But hope you'll remember why I wrote this down. Let's just go there now. So one of the other things I want to mention is we cannot give a formal apraxia diagnosis, in my opinion, without ruling out other things first, right? And so to see like a 2-year-old come through with an apraxia of speech diagnosis when so few other things were assessed, that's concerning to me. And I'm not an apraxia expert. I did recently have a couple people on the podcast who, we had great feedback from those episodes. Alana Bondar was one of them, for example. You can go listen to her episode and the episode after that. The point is, when we're diagnosing and we're calling it a comprehensive evaluation, just please be very specific to what you're assessing. Call the evaluation something that mirrors that, and make sure that if you are assessing something that requires you to also do other types of assessment to rule things out before giving a diagnosis, we speak to that properly as well. Okay. That's kind of where I was going with that. Okay. And then the last thing I want to say, this is probably going to be a super short episode because this is really just a Hallie, why don't other people teach this? Like, we teach it inside Feed the Peds. Like, I teach you how to do a comprehensive feeding eval, and we call it a comprehensive feeding evaluation because that is what it is, right? But we are making sure to cross all our T's and dot all of our I's here. And here's the thing. The other thing, if you're going to send a 17-page report and you're going to call it comprehensive, it should be pretty comprehensive at that point, no? Anyways, that's neither here nor there. I get this from like so many different practices all the time, which is why this is kind of just popping into my brain. The other thing is, I think that our recommendations need to be specific to a child and not always just copy and pasted. It's very obvious to copy and paste things to others, to other, individuals' evaluations and their reports, especially when you forget to change the name or the pronouns. Hint, hint, you might want to put something in your little process where you remember to do that. But if we're going to give recommendations, like I saw something recently and I was like, one of my therapists actually that inherited the child pointed this out to me. And I was like, oh yeah, that's interesting. And I'm going to change it so it's not obvious who this was in case this person listens to my podcast. But let's say you want the child to stop, grazing all day and eating food all day and avoiding mealtime. We're not going to then in turn around and make like suggestions for them to make requests in whatever modality they're using to make requests. We're not going to say we're not going to have them request food as the main example, like all day long. Like, yes, obviously communication around food is important. But if we're trying to cut something out that the child just let's say the child eats one food all day, right? Or 2 foods all day. That's all they want. They're grazing on it. They're not eating meals. And we need to expand that diet. We're not going to turn around and go, oh, hey, maybe you should work on having the child ask for veggie sticks all day. Hey, encourage them to use a sign for veggie sticks or use a sign for, that particular snack or whatever, right? I think there needs to be more care given to the reports, or make them a little shorter so that you're not accidentally leaving things in from prior reports that don't need to be there. That's just me. I don't know about you, but we can go here too. The length of reports I think is important. I personally don't want to read a report every single doctor that I've talked to that we refer to does not want to read a long report. And so if you can get the meat and the potatoes into like a summary to share with other professionals and or learn how to make your reports a little shorter, it's just my, suggestion. So take it or leave it. I do think that it would be, one, better understood by the parents reading it versus all the other stuff we put in reports. And two, I think that it would also be helpful for other therapists and especially the doctors, like receiving that report to understand, the meat and potatoes, right? Maybe we just need to add a summary because I know there's some people who are like super long report writers and that's never going to change. And I'm not judging you. That's totally okay. Maybe that's also why I started to really like the feeding world, because I felt like my reports were like so much shorter than my reports when I was in the speech and language space prior to being, really solely just a pediatric feeding therapist. But anyways, all right, that's it. This one's a super short one. I do think that understanding what needs to go into a report, understanding how to actually assess and how to dive into proper assessment, right? And not just writing things off and saying like, oh, I did an oral mech exam and the child's fine. 9 times out of 10, when I get those, the child is not fine. And that person completely missed a very obvious to me issue. And so that is what we're talking about inside, Feed the Peds. We teach you how to assess. We teach you how, we give you sample reports. We teach you how to make treatment plans and basically turn that information into, take that, go back to the family, talk about what's important to the family and what we see as, needing to be addressed through our therapy. And then together we come together and decide on what the treatment plan is going to be and how best to proceed forward. Because it is very responsive based and it is very family oriented. They're a very central part of the feeding team, right? So we need to make sure that we are addressing what's important to the parents as well, which is, I could go off on a tangent about that because these days I still see a lot of therapy that is not patient-centric. It's not family-centric. It's not responsive. It's basically what the therapist thinks needs to be there and the therapist does what the therapist thinks they need to do. And when you're doing to somebody instead of with somebody, your therapy is never going to be as successful as when you're doing it with the patient or the person or the family unit that is sitting in front of you. So conversation for another day, but, really got to lean into learning how to get those families on the same page and on board with what you want to do, especially if what you're doing directly ties into the reason that they're there. It's our job to make them understand that, right? So I know this was kind of like a tangenty, is that a word? Here I go making up words again, episode today, but it's because I saw something come through and it's my continued hope that as we bring more SLPs and OTs through Feed the Peds, we can help share what we've, experienced and what we feel works really well and really best supports our patients and their families and the other professionals that are working together on patient cases. So hopefully this is helpful. The doors to Feed the Peds are open, as you heard, and as you will hear probably again in a second. But go to www.feedthepeds.com and join us because we only have doors open for 5 short days, and our certification will be rolling out later this summer. So this is the last cohort that you'll be able to enroll in prior to the certification rolling out. So if that's something that you may want to enroll in as well, down the line, I don't have all the answers for that right now. I don't know the details on that. Final details are still being ironed out. So if you email us and ask us about the certification, we might have some answers, but a lot of it might still be, I don't know yet, because we are currently meeting and figuring these things out, ironing that stuff out. We're still like 5 months out at the time of the recording this, but several months out from actually opening doors to that. Just wanted to let you know, though, this will be the last Feed the Peds course before that is rolled out. So if that's something you want to consider, because you will have to have taken Feed the Peds to be a part of this this first cohort of, those going through pediatric feeding certification with us. If that's important to you and you've been waiting to take Feed the Peds, now is the time. Jump in. Will we offer the course again in the future? That is our plan. Yes, only one more time later this year. But I don't want to cause any confusion there. But if you are hoping to take it so that you can enroll in the certification at the end of the summer, this will be the last chance you can do that if you have not already taken Feed the Peds. All right. Hope that makes sense. Let me know if I confused you. support@feedthepeds.com. We'll see you guys inside the course if you're joining us. Otherwise, just get out there and please pay attention to what you're putting in your reports. Pay attention to what you're calling reports. Pay attention to how you're diagnosing and making sure that you're actually ruling all the things out that you need to rule out in order to make a proper diagnosis. And and I think, just to kind of put some context around it, I used apraxia as an example because we actually received an eval this week where the child had a diagnosis of apraxia from a speech pathologist practice, and they did not do a formal feeding or oral motor evaluation. It was informal with very little information included. My therapist went and saw this child, and the child does not appear to have apraxia. The child was imitating everything with ease, communicating very well with the therapist to the extent they were able to, but did not appear apraxic. And upon further evaluation, this child has some oral motor things going on, but also able to engage in some early imitation. And this kid is 2. Okay. So that's kind of why I was picking on apraxia. This was not meant to be an apraxia, topic kind of conversation, but I wanted to put some context around that. All right. I'm going to zip it. I said this would be short. I hope that some of these topics are just either helpful to hear or good reminders. But yeah, SLPs and OTs, join us. Can't wait to see you inside the course. This is Hallie signing off, and I am done with all my tangents for this week. So can't promise there won't be more on social media, but that's what's fun, right? We get to have little tangents and stuff. Come into the Q&A box, join me, ask all the questions you have. I'm happy to answer them. We will be doing a live Q&A also, I should say, this Wednesday. Should plug that, 7 p.m. Eastern. And we always do a little bit of Q&A around TOTS, tethered oral tissue stuff for those who join, but I do it to answer questions about the Feed the Peds course. And sometimes I also give away one last full scholarship. I don't know if I'm doing that yet or not, but if we have over 100 people turn up, then maybe I'll give away a free scholarship. We'll see how many of you register, right? One last free full scholarship to the Feed the Peds course. All right. I'll see you guys there.
Thanks for listening to this podcast. If you found value in this episode and want to hear more of these myotots, airway, and feeding related episodes, be sure to leave a review on Apple Podcasts and share this episode on your social media platforms. You can access free resources and all I offer at halliebalkin.com or pop over to @HallieBalkin on Instagram to get all the latest updates.